Hello everyone. I would like to welcome all of you to Xpert Matters, and we are very happy to welcome Dr. Niranjana Raj. I know you've been having a very busy day, Niranjana. Yeah, even today on a Sunday you had some procedures, so we are very lucky that you could join us today for this interaction.
So
Thanks
happy
for
to join.
Yeah, and I'm Ghazala Amin. I am the founder and the chairperson of GizBo Private Limited, the sole global distributor of XpertOnline. For those of you who do not know what XpertOnline is, it is very, it's a personalized, comprehensive, very confidential and secure virtual online clinic for doctors. This app can be shared by the doctor with his patients, and the patients can share it with their family and friend. And recently, actually, we also launched this app specifically for our community, windmills. And there are a number of curated doctors on that. And one of them, of course, is Dr. Niranjana Raj, who's also a resident of windmills. I know a lot of windmillers have joined in today, so a very warm welcome to you, to all our other friends and other doctors who have joined in for this session. Xpert Matters is an kind of an interactive series which is hosted by XpertOnline, in which we try and talk to doctors and health practitioners from different fields, find out about more, and we get more insight in their specific field, and also try to understand the need for online consultation in the present context. So I would like to first of all introduce to you Dr. Niranjana Raj. She's a consultant dermatologist, cosmetologist, as well as hair transplant surgeon. After completing her MD in dermatology, she went on to do a one-year fellowship in dermatology and hair transplantation from Bangalore Medical College and Research Institute. Her field of interest is cosmetic surgeries, and she has done, you won't believe it, more than 1,500 hair transplant surgeries to date. At present, she is the managing director of Yogiraj Center for Dermatology and Cosmetology, YCDC Bangalore, and YCDC Trivandrum, and YCDC Aesthetics, with a team of 14 dermatologists working with her. So we are really lucky to have Niranjana, Dr. Niranjana with us, and she'll be able to tell us a lot, I'm sure. Now, of course, Dr. Niranjana, all of us just want perfect, flawless, glowing skin. So tell us as to what has been your experience when patients come to you. What are the basic issues that they want to consult you about?
Sorry, the internet went off in between. If you
No
don't
problem.
mind, can you repeat it?
Yeah. I was just saying that all of us just want this really flawless, glowing, perfect skin. And, you're such a busy dermatologist. So with regard to skin, maybe from the cosmetology aspect of it, the perspective, what are the main issues that patients come up with when they come for consultation to you?
So regarding dermatology, we do experience a lot of concerns like eczema, psoriasis, lichen planus. But regarding the cosmetology, I think the most commonest will be acne, especially in the younger age. We even see a lot of patients coming to us with adult acne also. So post 30 years, they do come with acne, especially those who have a bit of hormonal imbalances. Second will be pigmentation. They come and tell us, doctor, I'm not liking my skin. It is uneven. I'm having a lot of pigmentation, tanning, pigmentation around the mouth, around the eye. So that is the second most commonest concern, pigmentation. I guess the third cosmetological concern will be anti-aging treatment. So they come to us telling, doctor, when to start, what to do. They tell us our concern, my face is looking tired, I have a sad expression, I look very dull throughout the day. So those are the main concerns.
So what about acne? I think it's not just teenagers who get acne, even later on in your life, sometimes because of the hormonal changes, and also stress can trigger off the problem of acne. So how do you treat it?
So acne, it always depends on the type of acne. So once we consult the patient, either see photographs or, direct consultation, we can recognize what type of acne it is. So nearly 10 to 12 variants of acne are there. So if we see a lot of blackheads, whiteheads, that type of acne, mostly it is because of usage of some product on the face which is clogging the pores, like a comedogenic product. So the treatment management will be based on that. Or if the acne is mostly distributed along the jawline area, it mostly points to a hormonal imbalance. So investigation along that line with an ultrasound of the ovaries and, hormonal testing and treatment of that problem might help to settle the acne further. Or third, sometimes they will have a lot of big cystic acne, nodular acne. So then we have to rule out any bacterial infection which causes acne. So basically, it depends on the type of acne, how we manage. We always incorporate a skincare regimen depending on the type of skin. So it's not like only oily skin people will get acne. Dry skin people also get acne. So we use a face wash which contains salicylic acid, glycolic acid. The moisturizer we recommend depends on the type of skin, whether it's oily skin or dry skin. And we use active ingredients at night in order to suppress or dry down the existing acne and also clear off the post-inflammatory pigmentation, whatever they come with, some spots or scars, whatever their concern is. So that will be the skincare regimen. So if we rule out the underlying causes and treat, more or less, it will come into stability. There are treatments which is done under dermatologists if we find, in spite of all this, that the acne is still coming, and especially in the older age group, above 30 years, it is mostly hormonal. So if we investigate, treat that, and still it is coming, there are treatments like treatment with retinoids and all, which should be done under strict supervision of a dermatologist. It shouldn't be taken over the counter. So those are known to permanently stop or permanently stabilize acne. So that is the kind of management we do.
And I think these are some oral drugs also which are given so that the production of oil is reduced if it is because of the oily
exactly
skin.
Yes, exactly. That is what I meant by retinoids and all, but that should be done under treatment with a dermatologist itself. It's not an over-the-counter medicine, and there is a standard protocol to give that medicine. So once that is taken and we achieve a dosage according to the cumulative dose for the body weight of the person, in fact, the person can be rid of acne altogether. Sometimes we do.
Yes. Yeah, when teenagers especially start getting the spots, the acne, what is the right time that they should go and consult a dermatologist? Because most of the time what they're doing is they are buying something over the counter and applying these creams. But when do you suggest they should take it really seriously and come and go ahead and visit a dermatologist? It is a serious matter and they must.
I think as soon as the acne starts itself, it's better to incorporate a regimen to keep it in control. I'm not meaning like you have to give them antibiotics or anything else, but using topical regimens with cream, with cleansers which contain acne reducing ingredients. So early age itself, it is better to start, because if we see like in teenage age or girls who once their cycle starts or menstrual cycle starts, that is when they start to break out, and that leaves a lot of pigmentation and it does affect them. So psychologically, even though they're going to school or college days and all that, once they start getting acne because of the pigmentation, because of the spots, they do feel very uncomfortable. Sometimes they do get it on the upper chest, back. So I feel as soon as they start getting, it's important to incorporate a regimen to keep it in control, because then we are preventing the sequelae. Like we are preventing scars, we are preventing pigmentation. So all those kind of things can be stabilized.
And if someone does get those scars, you have some procedures to take care of that, to even out the skin?
Yes. See, once the picked or deep marks are formed, like, ice pick scar or a rolling or trough shaped scars and all, actually during that time, no cream is going to be able to lift it up. So I say always, it's like a hole in the road. You have to pour tar to lift it up, right? So once the scar is already formed, later we have to do procedural management with lasers, with microneedling technology. These are all meant to stimulate the elastin and collagen in the skin to lift up and fill up the base of the scar. So that makes it a bit more smoother and a more contoured appearance. So the depth of the scar won't be visible. In fact, laser can stabilize even up to 80%. It can improve the appearance of the skin.
And the second issue you mentioned was pigmentation of the skin, unevenness, dullness. So how is that treated?
So again, the pigmentation, there are a lot of types of pigmentation. Somebody can come to us with freckles. That is mainly because of sun exposure, and also because they have a genetic tendency to get these sunspots. Some people have melasma, hormonal type of pigmentation, a butterfly shaped rash on the cheek area. So then that treatment, the causes are different. So that treatment should depend on the underlying
Also
causes.
because of thyroid
Yes,
imbalance.
exactly. Exactly. Thyroid is one of the underlying cause which makes the skin to get melasma, or intake of oral contraceptive pills, or even a genetic tendency. So that is causes of melasma. Some people can have otherwise diffuse pigmentation of skin, maybe due to an irritation due to a cosmetic, or it can be generalized tanning, or underlying disease conditions can also cause pigmentation. So always our treatment and management depends on the depth of pigmentation and how severe it is and the causes. So if we are ruling out the underlying causes, then we can treat with creams. If the pigmentation is lying in a superficial level, like in an epidermal level, if it is lying, we can treat with creams. But we always expect the patient to have a bit more patience. We'll say, okay, you should be prepared to use a skincare regimen for at least 3 to 6 months. Don't be sad when it's not improving in 2 months and all, because it takes time. The cellular turnover takes place over a period of 2 to 3 months. So creams to produce a benefit, it will take at least 3 to 6 months. And if by chance they want a faster response, faster improvement, means then we add on something like peels. Peels, what happens is it takes off the superficial layer of skin. So the fresh skin below will have lesser pigmentation, and that works much more faster. And in case it's a very deep pigmentation like solar melanosis, a kind of pigmentation which comes on the forehead, especially in men, these are deeper type of pigmentation. And then we do lasers, because the target chromophore is the pigment cell like melanin. So it beautifully destroys and removes the pigmentation, and it can give clear skin.
But one has to have patience. It takes a long time.
In pigmentation treatment, yes, definitely.
And what about, you were talking about mature skin, how to take care of as the skin becomes maturer. And what age do you think is the age when, even youngsters, or when you're, older, you should start this kind of treatment?
Yeah. So I believe around 25 years of age itself, even when the person is really young and the skin is fresh, at least start incorporating something like a sunscreen. At least it prevents the solar damage to the skin cells, and it is an anti-aging regimen also to incorporate a sunscreen. So I always say 20 minutes before you get out, you have to apply. And even though if you're given SPF 50 plus, doesn't mean like you applied and you're protected for the entire day. It lasts around 4 to 5 hours. So you have to reapply. So sunscreen is very, very important. It's like a daily skincare regimen. And also incorporating some active ingredient at night, which will take off the tan, which will improve the texture of the skin. Something mild like vitamin C and glycolic acid and all ingredients can be used at a younger age. But that is at a younger age. When the skin is a bit more mature, like in the 30s, and when we go into the 40s and all, superficial fine wrinkling starts happening on the skin. And that is when we can incorporate creams with a bit more stronger ingredients like retinol and all. So that should be used as a night skincare regimen. Depending, the formulation can depend on the type of skin of the person. But if it is a stabilized skin, like we are obviously seeing wrinkles, there is sagging, there is lines like nasolabial fold, you have like frown lines over here, bunny lines, crow's feet, all those kind of things, it can't be stabilized with creams. And that's when we go into Botox or fillers, or it can take a lot of age off the face. So that is when the skin is a bit more mature, the next level.
Yeah, I suppose lots of people would like to know about Botox and fillers. And also there is a lot of apprehension as to how safe these things are, since they're being injected into the skin. So maybe you could tell us a little more about this. Botox and the fillers.
And the fillers. Okay, fine. See, Botox is botulinum toxin. It's basically a neurotoxin. So what it does is it reduces the action of the musculature. Now, our skin is attached to underlying muscle layer. So when our face moves, like you are smiling, you're frowning, you're lifting your eyebrows, scrunching your face, all this, because of the movement of the musculature, the skin also moves. So with time, the wear and tear happens and the skin forms folds along the lines. It's like if a person is smiling a lot, they have a tendency, they develop lines like along the nasolabial fold. Or the person has a perpetual frowning expression, or always raises the eyebrows, they get the frown line, the lines here, or the lines on the medial part.
So there's no escape. If you smile, you get the lines. If you frown, you get the lines.
Lines are going to come no matter what, but we can prevent it or delay it.
Yeah. So what is done? Yeah.
So basically, when we inject Botox, it decreases it's a neurotransmitter inhibitor. So it decreases the action of the musculature. So it decreases the contraction and movement. So it gives rest to the skin. So when it is done very mildly, it starts settling the skin and it prevents the formation of wrinkles. So when it is done a bit early stage, so lines are of two types. There are static lines where, you are even like looking straight in the mirror and you can see the lines happening. You can see a prominent fold in the skin. And there are dynamic lines. Dynamic means with movement, with expression, you're going to see the lines on the face. So when it is dynamic itself, if we treat, we are going to prevent static lines. So when we inject in an early stage, a very mild quantity, it stabilizes this and prevents the formation by giving rest to the skin. Basically, it is that. So like when we do early, once the lines are prominent, there is nothing we can do about it. Even Botox injection is not going to remove it. So it's always better to do it at an earlier stage to prevent such sequelae from happening. Now, a lot of people are apprehensive, as you were telling, because Botox is equal to frozen face. That is what everybody thinks. Okay, frozen expressions, frozen forehead. So this is because of overdoing it. We can do it in a very mild manner. It also depends on the concern of the patient. So when the patient comes, we can say you just require 12 units. But if they are in the film industry, they are in the media, they want a more tighter expressions, they want the eyebrow lifted, they don't want any lines here, they want fuller lips. So all these kind of things come depending on the patient's concern, and that is when some people are forced to give more products onto the face. But when it is done in a very mild manner, it is just going to work like an anti-aging treatment to prevent. That's all.
And it is, you think, and you say that it's safe and it does not have any side effects?
Definitely.
It is being injected into your skin?
No, it is very safe. It is done into the superficial musculature. It is not going into the nervous level. It is not going into a deeper layer. It's just below the skin. We inject it intradermal. So it is like very mild, just below the surface of skin. But when we inject something like fillers, so fillers is a total different thing. You were asking about that. So fillers is meant to give support. Filler is meant to give support to the face. So what happens with age is a younger, youthful face will be more triangular. When we get old, our face tends to sag. The volume over here dips down here, and the volume here dips down, and we get jowls. So basically, in order to lift up the face, if this area is very thicker, more prominent, when we inject over here, it will give a lift. We can tighten the face, we can lift up, create a jawline. So fillers are used for a variety of purposes. It is actually, it is hyaluronic acid, which is a normal constituent of the skin. It's normally there in everybody's skin, but it gets degraded with age. It gets washed out with the lymphatic system. So we are replacing a molecule which is lost. That's all. So there won't be, there are no allergic reactions because it's already present in the skin. We are just replenishing it. Second, it is not very painful because it has a molecule like a lidocaine, which is making it painless, like an anesthetic agent when we are injecting it. So we can even use it in the under eye area. Some people want a bit more fuller lips. Some people want a bit more chin elongation just to maintain facial symmetry because oval face is in. So like that. So like those kind of things is what we use for. It's always like we have to do it in a moderate manner. Overdoing anything will give a plastic appearance. So that's what everybody is afraid of. They're seeing a lot of celebrities who have overdone this. So that's what they equate it to.
So let's move on to hair transplantation and hair care. And because that is also your specialty. But first of all, let's take up the basic issues that most of us have with regard to hair, thinning of hair for men and also for women. One was not aware of it, that even women, as we grow older, there's a thinning of hair on the top of the head of women and graying of hair. And, other issues. Can you please throw some light on all these issues?
So hair fall is the most commonest indication for which I think 30% of our OPD is hair fall itself. So Yes, so hair fall can be because of a lot of factors: water change, climate, stress, vitamin deficiencies like vitamin D, B12, iron level, thyroid deficiency. Even if somebody went on a crash diet, lost a lot of weight, or high fever for a few days, like typhoid, dengue, malaria, chikungunya, high viral fever. So many factors are there for hair fall. But when hair falls, a new root comes through that point. It doesn't leave that area empty because there are stem cells below the level of skin keeping on regenerating new roots. So however much hair fall happens, nothing to be really worried about, because 40 to 50 hair falling per day is normal. And if it goes beyond that, there are a lot of treatment like peptide serums, and we rule out the underlying conditions like vitamin deficiencies and all, and supplement with tablets which balances out that deficiency, and also something with biotin and green apple extract and all, which supports hair growth. So hair fall is something much more easier to manage, and the treatment will be somewhere between 3 to 6 months. So hair fall is different and hair thinning is different. So when females notice the partition widening, or the males get bald, it is actually not because of hair fall, it's because of hair thinning. So basically the hair is sitting there and becoming thinner, finer, lighter, smaller, becoming like a baby root, and then it is disappearing from the surface of skin, and that leads to a permanent hair loss. So how we differentiate it is like we see the scalp under a dermoscope or a skin surface microscope, and we see whether there are diameter variations and all in the strands, and then our treatment management depends on what we see under microscope. So if by chance it is hair thinning, then the treatment management and protocol is totally different, wherein we can use a serum to stabilize what is there. So medical management has evolved only till what can maintain. So till now, there is nothing which is found out which can regenerate an empty follicle. Once a hair is lost, it is lost. So medicine can retain what is there, even the tablets, everything we can use to retain. And also you had asked like why balding happens over here only.
Yeah.
So
Yeah.
80-year-old person also fully bald, you see like 5 centimeter above ear attachment going behind that area hair is there. Okay. The reason is this area of scalp and this area develops from two zones. It fuses together. We get our scalp skin. So especially for males, what happens? The hair over here is permanent because the hormones can't attack that root. They are genetically receptor free. So hormone won't thin it out. Like their beard root, like their chest root, like the eyebrow hair, they stay throughout life, right? So similarly, the hair over here stay throughout life. Whereas the hair over here, if there is a tendency, it can get attacked by hormones, or genetic tendency can come into play and cause the hair to thin out. So males, it is very clear cut. This area hair doesn't go. But females, yes, it comes mostly in we call it a Christmas tree pattern, because the frontal area, like a triangle, it can thin and the scalp visibility can be more. And it's very stressful because on a front appearance, they do see a lot of scalp visibility. They get worried about it. In females, it is not very clear cut. Like this area is permanent. We can't say. Mild bit of thinning also we see. But more or less, this area hair stays. Only this area thins out a lot. Then after medical management, usually we go in for procedures if we find that, okay, it is not getting stabilized by it.
Okay, and that is the hair transplantation that you do, which is a long procedure, is it?
Yes. So prior to doing it, we do procedures like either we can use a laser helmet or we can do PRP treatment. Nowadays, there are helmets which contains diodes which stimulate the hair and even stimulate the growth factors. So the person just needs to come and keep it on the scalp. It will, the light diodes which are there is going to stimulate the hair growth. So in spite of that, the next thing is we go in for invasive management. It is called as platelet-rich plasma therapy. So we have cell called platelets in our blood, which release something called growth factors. They are the wound healing cells. So in that treatment, we take out your own blood, concentrate the platelets, and this concentrated platelet will inject it at the scalp, at the level of the root. So there are no additives. It's only your own blood. The wound healing cells are concentrated. When the growth factors are released on the scan, it starts, growing the hair. It starts giving volume to the existing hair. See, if I'm going to inject over a bald area, it is not going to respond. But where there is hair, it will respond. But where there is no hair, then we have to do a transplant itself. So in that, what we do is the hair over here, which is permanent, we take a few and then replace it on the area where it has gone bald, or where the follicles are not going to come back again. So that is transplant. That is the third option. That's a final option. If you see empty areas under microscope, no medical management or no procedural management is going to help it. then we have to go in for an implant. Especially for ladies, we don't go in for a full implant. We put density just the front 2 centimeters so they can comb back and then cover the posterior thinning area. But males, we go for a bit more extensive implant like that. But it's an extensive procedure. It takes minimum of 8 hours to complete one surgery. Yes.
So what I understand is, be it with skin or with hair, whenever the problem starts, one should go to a dermatologist or a hair expert and immediately start the treatment so that you can, try to reduce the acceleration of that problem as such.
Because if it is hair thinning, early stage, I'll say medicines will retain, PRP will regrow, transplant will replace. So better not to go to the replacement stage. Start with the retaining. So
and what about graying of hair, doctor? What about graying of hair?
Yes, a lot of factors do cause graying of hair, but it's a natural process. Everybody grays. So in 30s, if they come and say graying, definitely a few hair will start graying around that time. But if it is an early graying, then that is when we start investigating for any underlying hormonal imbalance or thyroid imbalance, vitamin deficiencies like vitamin D or B12 deficiencies, or if there is a family history of early graying also, a person can gray. But the problem is there is no clear-cut treatment till now. Whatever hair is grayed is going to stay gray itself. Okay. So the problem is the pigment cell called melanocyte depleting from the hair strands is what makes it gray. Now, out of all imagine 100 hairs have grayed, only 15 to 20% of the hair will have that pigment cell. And when we treat, only those are going to respond. So if I'm giving a treatment and the minimum duration of treatment is 6 months. So if I'm giving a treatment, people will come back and say, doctor, the hair is still like that, because they are not going to notice that 15 to 20% is the one which is responded. Only thing it will do is prevent further fast graying. So that is what can be done.
And how safe are the hair dyes? Or, I want you to tell us about that. What kind of hair dye can be used? And also those who go in for hair coloring and bleaching, how much does it damage the hair follicles and the...
So if the person's hair is strong, see, even I have colored my hair. So if the person's hair is strong and, the hair has a bit of shine and strength to it, and you're not having any hair fall and no underlying causes are like that, hair thinning and all is there, it's okay to go in for hair coloring. There is no problem with doing that. But always I would suggest to go in for ammonia-free and all those kind of products like paraffin, diamine, PPD-free products. They are the best ones to go ahead with, and it won't cause any reaction, and it's more or less protective for the hair. So that can be used. And whenever shampoo is used post that, preferably going for something like sulfate-free and parabens-free products for that.
Okay, thank you about that. And with regard to the dermatology problems, we've been dealing with just now. We've been discussing the cosmetic aspect of the work that you do. People do come to you with regard to rashes, eczema, white patches, which you must be treating.
Yes.
So how many of these cases come to you, and how do you treat them?
So actually, eczema and all, there are seasonal variations. Now, from August onwards till January, because the season is a bit on the colder part, there is a lot of exacerbation of such skin condition, because anything that strips the skin of the natural oil barrier, and because of the climate and the cold temperature and all, the skin can get dry. And if you leave it like that without moisturization, definitely eczema and all is common. Dry dandruff, eczema and all we see in this season. Vitiligo, we see maybe like 3-4 cases a week. It is still there. People do consider it a stigma even now. They get worried. So those and all are treated. They come to us in an early stage itself nowadays and start treatment. So these are common conditions, but not as common as acne and all that. Yes.
Okay. And recently there must be a lot of people coming to you with COVID-related issues, for example, the acne which comes up because of wearing masks constantly, or the dryness of the hand because we are using sanitizers and washing our hands very often. So what do you recommend for that?
Yeah. So yes, the new term has been coined. It's called maskne, because mask-induced acne. mostly it will be distributed along the jawline. Previously, only PCOD-induced acne used to be coming along the jawline. So nowadays, we do see a lot of people coming over this area with acne. But the main problem
Yes.
is the mask usage for a long duration tends to clog the sebaceous gland or the oil glands. So they are not able to let out the secretions properly. And because of the clogging of the oil glands, it tends to get secondary infected, and then acne comes. And also when they repeatedly use a mask, nowadays we see a lot of people using cotton masks. So over makeup, over then the lipstick, the foundation, everything gets transferred over there. And then you keep on reapplying the mask that comes in contact with the skin. Again, it can clog the pores and that can stimulate acne. So that is one of the things we see. Definitely frequent changing of the mask, and when you are alone, at least give time for aeration to the skin and breathing of the skin, and washing with salicylic acid base or glycolic acid base face wash, and a topical regimen will help to settle it. And with regard to hand dermatitis, yes, once the COVID season started, we are seeing a lot of hand dermatitis, especially with eczema and severe dryness and redness of the hands. So in an early stage, I'll say, because you're washing your hands a lot, you're washing with soap, and that 20-second wash is happening, and repeatedly using sanitizer. So the alcohol in the sanitizer all tends to strip your skin of all the natural oils. And that takes off the superficial protective barrier to the skin and cause a lot of scaling and irritation. So what I would advise at an early stage itself, keep repeatedly using a moisturizer. I tell my patients, keep a moisturizer right next to your where you're going to wash your hands, because every time you wash, I want you to apply a moisturizer. And even after every time using a sanitizer, it's always better to moisturize. But if it is a bit more severe, it has turned into a rash, redness is there, irritation is there, that is when a dermatologist consultation is required, and we might have to give some creams to suppress it, and then you can maintain with the moisturizer.
Yeah, thank you. And I would like to request all those who have joined in that if they have any questions, they can start asking the questions, and we'll collect them. And at the end of the program of this event, we'll be able to put them to Dr. Niranjana, and she'll be able to answer. Another thing which came up in my mind was that, things like moles, skin tags, or discoloration of skin, this whole, one gets scared about skin cancer also. What should one look at, look out for, and go immediately to a dermatologist for a checkup?
Okay, so moles are totally different from skin tag and all. I'll first tell about moles.
Yeah.
See, if a mole is coming up newly, or if a existing mole is growing rapidly in size, or we see a bit of bleeding or ulceration on the mole, or if we are seeing any satellite lesions, like in and around the mole, we are seeing tiny black dots cropping up. These are signs we have to watch out for. So that is when a dermatologist should be consulted, and it is always advisable like to get it checked under skin surface microscope or dermoscope. So once that is done and we are sure it is innocuous, but if it is increasing in size, always better to remove the mole. Okay, but unless if it is a stabilized mole, there is really nothing to worry about. And if it is innocuous totally under examination by a microscope, then also it is totally safe. Skin tag is totally different thing. It is a genetic tendency of the skin. A lot of people do get it on the neck area, underarm area, wherever the skin tends to rub, or when they put on weight a lot. But this is totally a cosmetic problem. It is not going to harm in any way. So what we advise is, see, whenever it comes in more in numbers, it is there on the face, it is there on the neck and all, and it's creating a appearance like, okay, they're concerned about it. We apply numbing cream and remove it through a procedure called as electrocautery. Once it is done, whatever is there will get removed. So I'll always say, if you have 20 skin tags, we can remove the 20, but that treatment is not going to prevent new 20 because it's your genetic tendency. So cosmetically we can remove. So what people do is, whenever it comes up more, they come and get it removed. That's what they do. Once in 2-3 years, they come and get whatever lesions are there on the face removed.
And what about, about your practice, your consultation during this lockdown period, and people are hesitating from going to clinics. So have you been doing online consultation, Dr.
Yes,
Niranjana?
of course. That has been very, very helpful, especially platforms like XpertOnline, because most of our patients have traveled out of station also. Many have been consulting their follow-ups, because there are patients, especially as we were talking about retinoids, where we have to give for long duration, and there are medications we put for which the patient has to take for 5-6 months. So in between, the treatment breakage can happen if they are going out of station, but they have been able to follow with us, connect to us with photograph, with video consultations. We can keep a tight watch on the skincare regimen, what they are currently following. Even not just follow up, all the data can be kept stored, so we can see what has been given treatment before, follow up of their blood reports. Even those who come and consult me directly, in spite of everything, they do come. The blood test and all, I ask them to send through the app, because then at least they don't need to come out again and again just for the sake of a consultation. We just need to see a report and prescribe. So those and all has been made easy. In fact, we never had the concept of teleconsultation till now, when it became a need or a necessity, and doctors, I think, are slowly adapting to this form. So in the first 2 months after that, now we developed a hang for it to consult like this.
And also, I suppose what doctors are finding is that the confidentiality of the patient is something which has been really very important for both the patient and the doctor as such. And, some questions have been coming in. Avisha Gopal asks, has there been a general uptake in the amount of people coming in for cosmetic surgery during the lockdown, since there's more downtime to recover?
Yeah.
Are more people coming
in fact, it was even surprising for me. Unless it was a serious dermatological consultation, they are not coming to the clinic. They are mostly consulting on online consultation platform. But those who want cosmetic surgeries, cosmetic procedures are all coming all the more now. Because, for example, if a hair transplant surgery need to be done, definitely there is a downtime of around 5 days. So nobody wants to let it be known that they have undergone a cosmetic procedure. So in fact, all those kind of cosmetic procedures has increased greatly now. Working from home was also advantageous, right, for them. They can take care better, take rest better. They don't need to go out. Nobody will know. These are the kind of things which is promoting procedural management nowadays. Yes.
There is Tanvi Deshpande who has asked, what about the recent craze of products like the Ordinary using concentrated AHAS and BHAS? Now, I don't know about that. You would understand maybe,
Yeah. So yes, the Ordinary, they are producing serums which contains active ingredients like acidic ingredients. Okay. So we might be using peels in the clinic, as I was telling before, to remove pigmentation. We have peels for anti-aging. We have peels for acne control and all that. So that will be in a higher concentration. For example, if you are using glycolic acid peels, we have 30, 50, 70%. In a lighter concentration, it's available. This brand is giving it out. I think it is there in US. So they have in a lighter concentration, which is meant for home care. If it is used in a very careful manner, all those products are good. Okay, but only thing, it has to be used carefully. That's all. Depending on the concern. For example, there are lightening acids. All of them are good because it will cause a desquamation of the superficial layer of skin. And if you're using products over it, depending on a concern, for example, if we have a kojic acid or arbutin or those kind of products for lightening, it will increase a penetration into the deeper layer. Or if somebody is concerned concern is anti-aging, retinol-based serums and all are available in this brand. So that will be helpful. But only thing is, use it judiciously, use it very less concentration, because it's over the counter. Sometimes it can tend to irritate the skin. So make sure you're using it in a lesser concentration in the initial period and then stepping up to a higher concentration.
That's the thing. We see these ads, very glamorous ads, be it for hair or for skin, all these products, skin and hair products, and we tend to go and buy over the counter. But you suggest that for any of these problems, be it with skin or hair, one should go to a dermatologist, an expert, and get the right medication.
Yes, definitely, because we have to be the skin lightening creams, which is available over the counter in the pharmacies. they do contain steroids. Many of them, even though they are banned, it is available in India. So it is available. The pharmacists do give out this for skin lightening. Those contain steroids. They contain hydroquinone, which is really banned. It's harmful for the skin. So we do tend to see a lot of patients who come with side effects like thinning of skin, white patches, acneiform eruptions post using that. So it should be very carefully used. It's always better to consult a dermatologist. And in fact, for a concern, like for example, a brightening concern is there, or an anti-aging concern is there, what the dermatologist prescribed, the contents will be much more stronger than what is available over the counter. So the active ingredients will be much more stronger because they won't have the license to give a product with so much concentration of ingredients. So it's always better to get the skin examined before going in for anything.
And the doctor would be monitoring the usage and giving you advice throughout and seeing the results and, like that. So it is important. That's something to be noted by all of us. There's Aishwarya Joshi who's asked, what is your outlook on the Korean 10-step skincare routine? Is it even worth the hype? Yeah. So, all these fads, I suppose, like for diets, you have for skincare, I suppose. Yeah.
See, I don't know how many people will be doing a 10-step. Most of the time we'll be working, coming back so tired to even wash your face before going to sleep. So I definitely feel that nobody can follow the full 10 steps. But first of all, using a cream to remove the makeup, then using a face wash. After that, toner only if the person requires it. I don't usually advise toner unless the person's skin is very oily. For a normal skin person or dry skin person, we tend to get people who have got irritated skin, dry patches on the face after using toner. So it also depends on the type of skin. Then using an active serum and locking in with a moisturizer. At least basic 5 you can do. 10, it's not possible. Nobody will be able to follow unless that is their profession. So it can't be done.
Okay, Tanvi has asked, what is the best age to get Botox done? I suppose it would depend on the condition of the skin, isn't it?
Yes. Basically, it depends on how much wrinkles are there. So I feel when you look at the mirror and you are raising your eyebrows or frowning or smiling and you see a fold forming, that is a time to get it done. So you're going to prevent a permanent fold. So you can do it in a very mild quantity to just settle it down, settle the skin down.
Yeah. And someone has asked, is hair transplant beneficial in the long run? Does it stay or is it temporary?
I'll explain that. See, transplanted hair is permanent. Okay. Why it is permanent is because we are taking hair from here and putting it into a bald area. So whatever hair we are taking from here, they don't have genetic receptors to which hormone can attack and thin it out. So when we are taking and transplanting that will stay permanently. But one thing to understand is existing hair won't be permanent. So for example, a person is bald fully and we are putting fully transplanted hair, his appearance is going to stay throughout life. But if a person has existing hair but has thinning space in between and we have to recreate a hairline, we can recreate, we can give a total change of appearance, but it's also important that he uses medicine to retain his existing hair because both together is what is going to give the coverage or the density. So that should be mandatory. But transplanted hair, whatever is there is done is permanent.
And if you have some problem with the scalp skin, can you still go ahead for hair dye?
Hair color.
Hair color.
So if
the scalp has psoriasis or something like that, can you still go ahead?
So it is always, if it is a very inflamed scalp, I won't advise at all because it can dry up the scalp more and causes more inflammation, like psoriasis, as you were saying. There's a lot of thickened scales and all on the scalp. I won't advise. So always use medical management to settle it before going in for a color. Otherwise, it will irritate.
Okay. And Anjana Gupta has asked, can we use laser comb at home regularly? Is it safe and beneficial?
So laser comb, it's similar to what I was telling as laser helmet. Okay. So yes, it is safe because the diodes, the wavelength which is there, it can stimulate the hair follicles and can stimulate the stem cells. It is very good. But it is a bit cumbersome to keep doing it. It has to be done at least 20 minutes, at least 2 or 3 times a week. So it's a bit cumbersome. So if you have not invested in that, better to get a laser helmet because then you can just keep it on your scalp and watch a movie or continue with your work. So that is more easier to do.
Okay. And is there, some people have also asked as to what kind of a diet they should have to have a good skin.
Okay. So
Can you
yes,
some-
that is a very generalized question. So basically, a lot of fruits and vegetables with water intake greater than at least 3 to 3.5 liters a day. Fruits is very important. Anything or red colored, orange colored, everything helps. But what I would say is 20 oranges equal to 1 tablet of vitamin C. So yes, when you are incorporating all that, yes, that will help. But in case somebody has acne, then we tell, previously our belief used to be junk food, oily food and all that. But now scientific studies have proven that it is milk or milk-based diet like curd, paneer, cheese, excessive amount of milk products or sugar. Sugar has been proven to be something which is going to trigger off acne. So depending on the concern also, for example, psoriasis, we'll say, okay, reduce mutton, beef, egg. So depending on the underlying concern, there is a diet. Otherwise, for glowing skin, I'll say more intake of fruits, vegetables and all.
Thank you, Niranjana. This has been so helpful. I'm sure I have learned a lot, and I'm sure the others also who have joined in today. So thank you so much. And for all those who were a part of this event, who were listening in and watching this, I would like to tell you that if you want to find out more about Xpert Online, you can DM to us on Facebook or Instagram, or best would be if you visit our website, which is XpertOnlineApp.com. And that you can connect with Dr. Niranjana also if you want to consult her, because from this website, you can download her app and get in touch with her. And from the site, you can also add more doctors to your app and make your own virtual personal clinic. And also for the doctors who want to know more about Xpert Online, please look up this site and you'll be able to find out all the special features of this platform. Thank you everyone for joining us today for this session. Thank you, Niranjana. Thank you.
Thank you.
Bye.